All right, let's get started. So, I'm going to review anatomy and physiologies. Some of you have already taken anatomy and physiologies in the 200 hours teacher trainings. So, for these 95 hours teacher trainings, we are going to cover the topics of overall review of human anatomies, movements terminologies, physiologies and development of children, postural faults in children, breathing, and I'm going to talk a little bit about mind and body interrogations in children as well as the changes in hormones and growth. Let's get started with the anatomy review. Yay! So we have many systems in our body. The most touchable ones and the ones that everybody is focusing on is the musculoskeletal systems. What is the functions of the musculoskeletal systems? Yes, it is to support and to protect the body and its organs. It provides motion as well. So when we move into different poses, we are using these two systems together, which is muscle and the skeletons. So that's why they call it the musculoskeletal systems. The major substructures of the musculoskeletal systems is called the tendons and the fascias. Yes, some of you have heard of this, correct? Without those things, we cannot really move or ordered our bodies to functioning. It must have been something that connects our muscles and skeletals together, right? Yes, and that's fascias and also structures of tendons. What is tendons and ligaments and fibers in our bodies here? So, ligaments, fascias, cartilage, bones, muscles, and joints. All of these things allowed our motions to be happened between the segments of our bodies. For example, we need to have the ligament tendons around the muscles of the joint of this shoulder here so that it is moving in and out or closer to our body, so and so. Okay, and we also have a connective tissue cells, which is extracellular matrix. So our tissue cells is very complex. Yes, it has the red parts that you have seen from the anatomy books, and it also have the white parts. Yeah. So after we have, you know, eaten some things that produce protein to our bodies, our circulation systems is working really hard to inject those nutrients that we ate and make our muscles and connective tissue cells functioning very well. And of course, connective tissues have to be a little bit soft and moistures or fluid so that everything goes smoothly. And the only thing that could give these connective tissues stays very healthy is through the movements. Right. And that's why we're doing yoga. Okay. So the connective tissue cells are also called the fibroblasts or the cells that producing the matrix of skins, tendons, and ligaments. Also, the chondrocytes or the cells that's producing the matrix of cartilage, and the osteocytes are the cells that produce the matrix of the bone. So all together here, fibroblasts, chondrocytes, and the osteocytes are forming the connective tissue cells. So here we go. The beautiful body. We have beautiful muscles, which is illustrated in the reddish colors tones, and we have the connective tissues, which is illustrated in the white part here. all of these are woven together in our body, right? And it's very, very hard to separate it. So I would ask you to imagine peeling an orange. So when you peel the orange, actually before you put that tiny piece of orange in your mouth, if you try to peel out that very thin layers of the white part, you could feel that actually the inside it's like a tiny little pouch of oranges, and inside that pouch it also looks like a very thin sack of something that is very light that hold the juice inside. Our body is also like that. It's amazing, right? So we should stay hydrated and we should keep moving. All right, let's move on to our structure of the bone. So here we go. How many bones do we have in our body? That's going to be in your quiz. And first of all, let's review our most important bone structures, which is the spine. So we start from the top here. If you could follow me and do this exercise together with me, you would be able to remember the names and also parts of our spines better. So we start from touching the back of our head. This is our first curve, or they can also call it the primary curve of our body. And then we have secondary curve of our body. So primaries, secondary. So it's concave kind of curve of our body. So the top here, underneath your skull, if you put your thumbs right there at the ends of your skull curve, you will feel a tiny little hold of it. And then when you press your fingertips onto that little loops, little hoops or holes of your underneath your skull, and then you start flexing your head or folding forward, nodding your head down, you would slightly feel that something is sticking out or coming out. So this is your first bones here, which is the start of our first columns or zones of the cervical spines. For cervical spines, we have, yes, 7 cervical spines, starting from the top one, which is called C1s, or they would call it atlas as well. The reason why they call it atlas is because of the shapes that looks like the horizontal lines of the earth or the atlas. So it's like holding your globes or your whole earth here on the top of the atlas. So atlas is C1. And after that is C2, the aces. So the one that you feel and it helps you making the action of nodding down is the C2. So C2 is the axis. It's located right here when you press your fingers under your head, as I showed you before. And then if you are thin, not chubby like me, you might be able to find all the 7 C spines along your neck. Just spend some moments trying to touch it. Right. Adults and children also have this 7C, C7 cervical spines. But for the kids, it might be really, really little. However, so when we talk about these top parts, I want you to remember one thing, that we have a thick bones or strong bones to govern the parts of the inner organs that is super fragile, such as skull and pelvic, right? And the rib cage. It's a kind of flat bones that is protective to our very complex and fragile inner organs. And from here, we have thin layers of skins and muscle. So we have less muscle here on the neck, but it is because it is governing the most important bones of our bodies. Where else do we have there? Lumbar spine, yes. Yeah, we have quite thin layers of the muscle though, but what is poking out is something else that is not muscles. Okay, let's continue. So from C7 here, if you keep nodding your head still, you will touch the highest part of the bony thing that is poking up here, and that's the connecting parts of the C7s to the T1. So T stand for thoracic, or thoracic, so another anatomical terms, they call it kyphosis, while the cervical one, they call it lordosis. So the thoracic spines, we have, yes, give me the number. 12. Why do we have 12? Right, because we have 12 ribs, of course. So our thoracic spines are, the main function is to help our body staying upright, right? But it doesn't do that job by themselves alone. It has to work together very well with the deep core muscles of the back, which we're going to talk about it later on. So thoracic spine starting from T1, counting on until T12. So T12 is slightly around your underneath your brow lines, and if you could touch at the back, you might feel the last ribs, no, the second last ribs from the back here, because the last one is quite thin. And by the way, some doctors take it out and put it on the nose for surgeries. Yeah. Okay, so from T12, let's connect to our back here. The nice curve of your back that when you are teaching, you like to encourage your clients to keep your neutral spines, or the natural curve of your back. That area is the part of the lumbar spine. So lumbar is also lordosis, so which means it's like a curve in. So we will talk about postural faults later, so please remember the words lordosis and kyphosis here, and how does it relate to the structure of your bones or your spinal columns. Okay, so after lumbar spines, okay, let's talk a little bit about the lumbar spines. The lumbar spine starting to be very thick. So if you could hold your fist like this, the inner part here should be able to demonstrate how thick and big your lumbar spines or your lumbar bones is. Right. So for the lumbar spine, lumbar bones, it's quite big because it has to be able to strength or strong enough to support the structures of your whole torso. And this torso part of your body is the most biggest, complex, and largest part. Of course, it's really heavy to carry a lot of things. And if we eat a lot, it's also working harder. So lumbar spine, even though there are only 5 of them, so L1 to L5, it's still considered very, very important because it is right here at the center of our body. It connects the upper part and the lower part together. So if the lower part is tilted or unstabilized, it results back to the upper part, as well as if the upper part is imbalanced, it will, result downwards to your lower parts, your hips, your feet, and your toes. So lumbar spine is very important. And the reasons why we are practicing movements so is because we can have the awareness of our bodies, and then we can help maintain our body in an ideal alignment structures, which will absolutely help the functions and structurals of our bones here, especially the lumbar. Okay, downward to the lumbar. If you press your hands above or a little bit underneath the curve here, in a palm facing down, so your sacrum is about your palm size. It's not that big. Yeah, it's quite small and cute, isn't it? The pictures look so cute. For us, we call it a diamond shape or a heart shape like this. Yes, because it is the hard part of our body structures. Sacrum here will connect with the pelvic girdle that looks like the butterfly wings later on. So actually sacrum is 5 bones that are fused together. So they looks like it's the whole piece in one piece, but it's actually 5 pieces. So that's why they have the name for it, S1, 2, 3, 4, and 5. And continue with the sacrums. We have that cute little tailbone, yay! And that is called the coccyx or the tailbone. The tailbone seems to be not really important for some of the people, but actually it does. It's just like the strings that the architectures or the builders are using to see how balanced the scales is. Yes. And that's why they have that tiny pointy part at the ends of the spines, which is called tailbone. And if you have an accident, your tailbone is very easily to break. It won't be able to mend back. It could just be staying there inside your body, floating somewhere. Yes, people say it does not hurt that much after I mean the recover period, but when it breaks, it's really, really hurt because that part is very close to the most complex and I would say the most fragile nerves, which is around the sacral area. So take a look at these tiny little holes here on the sacrums. These holes is the holes or the tunnels for the nerves as well. Yeah, for the nerve line. So if we take a look at on the sides of the spines, you will see at the back part here that bone is sticking out. Yeah, like a dino. It's called transversus. So we don't have equally amounts of transversus though. We are different. Asians could be different from Europeans, and even Asians could be different from each other. So if you have quite a long transversus, of course, it would restrict your movements, especially the extension part. In order to know whether it is very sticky or not, or is poking out a lot or not, you should do an x-rays, but instead of paying for x-rays, you could actually check behind your back or look at a person who's practiced in front of you when they do folding forward. If you see their bones popping out, layers of the back laying on the back like the pearls, that might be something that could relate to the pointy bones of the transverse. So if you might have seen many people who are quite bony at the back, they have restricted movements, especially when they do back extensions. Okay? Yay! Right. Now let's look at the types of joints. We have many types of joints, and the most famous, not famous, but the most common joints that we will look at and talk about are called synovial joints, cartilaginous joints, and the fibrous joints. Okay, so synovial joint is the joint that connects these two bones together like this. Yes, so it gives you freely movements. Where could you find these joints? Right, at the knees, and where else? At the shoulders. So here, synovial joints at the knees and the shoulders. And then cartilaginous joints is slightly movable or hardly move at all, very slightly. Where could you find this? In the vertebral bodies of the spines, right, between each part of your spines, each part of your bones, it is a cartilaginous joints, which is quite a thin layers, and they call that part the not spongy. I would say it's like jelly parts or gummy bear parts that connect our bones to bones together. They call it a disc. So if you are in false positions or repeating the same bad positions all the times, it could result that this disc could be exposed or bulged, which they call the bulging disc. And I hope that if we already know the basics of our anatomy here, you could also help pass on to the children so that they would have this mindset of corrective posture ever since a young age. Okay, and then we go to the last type of joints, which is called the fibrous. Fibrous is not movable at all, right? Just like the one that fuse together the skull here. So our skull here are actually flat bone that connect together like pieces of jigsaw. It will be here the frontal part, the central parts, and the back parts. Yeah, when we were young, and if you have a child, you would remember that the child head is quite small and it has a little hole here. That function is great because those bones are not fused together yet. It have to have a hole so that if they fell down, the air or something could still release out, and it create less pressure of the skull. So see, nature is so great. But when we are older, our skulls here are already thick and firm, and it's already getting bigger and bigger. So if you fell down and you knock your head on the floor, it's cracked. Right. So let's look at further. So we have more types of joints here. The one that is most fun to look at is the ball and socket joints, okay, or the spheroidal joint, because we have only two, and I mean not two joints, but two parts of the body, which is the one that connect our arms to the shoulder, and the ones that connect our femur or legs bone to our hips. So these types of joints is convex surface, which means it's like a globe, okay, and it have a concave. So it's a convex surface that locates in a concave cavities. So it's like the pen, the thread, the old fashion pen that we have seen a lot when we go to the hotel. Yeah, so it stay here. That's why it's allow many movements. Where can we find this? Yes, in our shoulder and our hip. So these types of joints is the champion of the joints because it gives you the wide ranging of all kind of movements: flexion, extensions, adductions, rotation, and circumductions. Right. Now, the opposite ones is the hinge joints. Why I said it's the opposite one is because it's only move in one planes or in very simple directions, which is flexions and extensions. So this kind of joints is kind of flat, and it looks like the hinge of your door. So if you move it at the wrong side, it's of course cracked, and you don't want that to happen, right? Right. So the motions of the hinge joints is allowed in one plane only, and it's only offer the flexions and extension movements. Where can we find these joints? At the elbows and the knees. Yeah. And also the hands. Not the knees. Elbow, hands, and also the ankles or the feet, where we do flex and point. So next one is condyle. These condyle joints also have the convex and the concave parts within the same side of the bone. So it's like a hook and a knot like this. It still gives you some movements. It gives you movements of two articulating surface. So, but it cannot isolate or separate them together. The example of the joints are the knee joints and the temporomandibular joints, which is around the hands. Let's look closer at our shoulder area here. There are many words and names of the anatomy, bony structures. So most of our body's anatomy names are Latins, and it's based on size. It could be different shapes, it could be different sizes, and most of them will locate from the bony structure. So for your easier understanding, and it helps you to remember the muscles names easier, is to remember the bony structures of the muscles or of the body. So our bony structures of the shoulders include, of course, the humerus. Touch your humerus! Humerus! Yes! And the clavicle. Touch your clavicle! Clavicle! And your scapulus. Your scapulus is like this facing down wings, chicken wings here at the back. So this is the scapulus, this is the humerus, and these whole piece things here is the clavicle. The scapulus is the anchored to the axial skeletons only by sternoclavicular joints. So sternoclavicular joints is the one that helps connect your scapulus and your bigger parts of the upper body together. So here there will also be different layers of muscles. I would say muscle around here looks like the strings. If you take the bigger strings or the candle and cut it in half, you will see inside there are like strings that is bind together or woven together. Our body is also, I mean, the way our muscle works together or stays together is just like that. When we move to one direction or when one muscle starts contracting, not just them that is doing their job, but almost every muscles around them are moving together because our body here is unity. We are unique. Yay. Okay, so this joint, sternoclavicular joint, is often called the scapulothoracic articulations since it's not a true joint. Right, so that's why we can do dung 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 a lot of movements on our scapulars here. Yay. And it's so fun to see people who have a very thin back that they do the movements of the arms, and you can see that the scapulars is slightly curving in and out like that nicely. Okay, so let's look at this picture here. This is a very nice beautiful illustrations picture of these upper girdles. Over here is the supraspinatus muscles, which is really thin, that connect your bony clavicle joint. I mean, that's connect to the scapulars. Yeah, and it's a little bit underneath the collarbone or the clavicle bones here. And these ones that you feel it's bony sticking out is called the acromion bone. Some of us has very poking out acromion bones, some does not, okay? And if you are working out a lot, your deltoid might cover them all, but still you can see it. And here is the supraspinatus tendons. So this tendon is really, really fragile, and it is very important as well. So, by the way, wherever there are thick layers of tendons and ligaments, that area is tend to be the trigger points parts of the body, right? So here, let's look at the left elbow and the anterior wheel. So this is my left elbow. So our humerus or the upper arms bones are connected with other two small bones, which is called ulna and radius. When you flip your hands or do pronations of your hands, guess what? The ulna is the bone that stays still, and the radius is the bone that actually move and rotates and do the functions of rotating the upper arm or the forearms. Cool. Let's talk about muscles, because we are covering the topic of musculoskeletal system. So I'm going to switch back and forth between the bony structures and the muscle structures for you to see the pictures here. Okay, so this is our anterior wheel of the bodies, and over here you could feel it and you could see it when you do your workout. The biggest part where you can touch it, it's very superficial. It's called the pectoralis major. And then the inner part where sometimes you feel aching, it feels like toning when you do a heavy lifting or even the chaturanga. So it's the pectoralis minor. Pectoralis minor is actually underneath the pectoralis major, and pectoralis minor is the one that connects right there at the joints of the humerus and the upper shoulder girdle together. And then from the front part of our body, if you press your hand right here on the side, okay, the superficial layers of the muscle here when you start contracting on the side is the latissimus dorsi. So latissimus dorsi is like the muscles that is wrapping your whole back. It's very, very beautiful structure, like wearing the girdle, or the suits, the body suits. Okay, so latissimus will wrap your whole back, and then coming to the side parts here, so it's all connected. At the posterior wheel of our top body, we will see lots layers of muscles here, right? Let's start from the superficial one, which is called trapezius. Okay, so this trapezius looks very beautiful. They're coming from the top of your neck and spreading out wide, create a beautiful shape of diamonds like and govern the top part of the whole body, and it's very superficial. So underneath the trapezius, or the thinner layers of trapezius, between the scapulars you will find the muscles which is really very thin. It's called rhomboids. Rhomboids is kind of like drawing the scapulars together inward, and when we practice many exercise that is bringing the elbows backwards and or moving the hands backward, you are working a lot with this rhomboids. Rhomboid is very thin, but it's also very important. So if you are rounding your back for most of the times of the day, this rhomboid is stretching out like the stretchy cotton t-shirt, and then when you want to contract it, it's really hard to contract or shrink back. So rhomboid for children is also very, very thin, but it's hard for you to train them. However, it's not that hard to create the sense of movement of the upper bodies and the feelings of the scapulars. Okay, so above here on the sides of your neck is called a levator scapula, and from here the top part where we already seen in previous slides, it's called supraspinatus muscle, which is the one that you can touch here on the tip of your shoulder. Right, and it's very nice when someone massaging you. So if you want to massage someone, please put or give pressures on the soft parts of the body only. Avoid the bony parts, right? And from here at the back, right here, it's called infraspinatus. And infraspinatus is kind of like governing the scapulars, and then it inserts under the deltoid. So around here is very, very complex, and there are also teres major and teres minor muscles, which also are kind of underneath the infraspinatus, and it's like spreading. Like I say, muscle does not really work by itself. It's work with the whole groups of the muscles around them. And the most superficial ones that we can see, and we want to have these toning of the upper arm, is the deltoid. Right, I don't have that beautiful layers of deltoids as well. What should we do? Should we lift more heavier weights? Maybe we could do something else better. Okay, so that's the posterior wheel part of the bodies. Now let's look at the bigger pictures of our whole back muscles here. So trapezius here, these parts. It's also covered the neck extensions or the neck extensor groups, okay? And these muscles here will absolutely how to say works when we do movements like neck extensions and upper body extensions. So if your trapezius is super tight or too tight, of course, it restricts your movements of doing extensions. If your back muscle or whole muscle and trapezius is too loose because you are folding forward or look at something on your hands for the whole day long, it won't be strong enough to help you uplifting your head, and you might sometimes experience the effect of head forward syndrome. So in order to help maintain a good posture in the upper body, we also should focus on strengthening the whole upper back muscles and especially the trapezius. Right. So along the spine lines, we have spinorous process. Right. And from the spinorous process here, so throughout this spinorous process, it looks like a hole where your nerves is going through that hole. So we'll talk about nerves and the track of the nerves later. At your back parts, you will see the biggest part of the muscles. Yes, it's the gluteus maximus. And it's the muscles that people really want to have. However, they said that this is the most stupid muscles in our body. And why do we need to train them? So, which one is the most clevius or the clevius muscles? It's the one under your skull here. Oh, yay. So, on that day, if you are very tired and you hurt your back or you work your butts too much and you want to relax, just massage under your scalp here and your whole body will be totally released of pain. All right, so let's look at the little parts of the bones here. It's very beautiful. So here is the spinal process. And these are the vertebral foramens. Wait, I'm going to zoom it for you. Okay. And the vertebral part of the bodies and the transversus foramen. So these areas here and here is where your spinal cords are passing through, and then it also connects and threads under the loops of the invertebral foramen, right? So this is how our bones muscles connected. So between them has the disc, and when we move or bending forward, this part of the disc is kind of like softening down because of the pressures of the two bones. And then we move in the opposite positions. Of course, the disc will be slightly squeezed in, but the transverse is pressing against each other. All right. And last but not least, so for these videos, I would like you to pause and spend your time just drawing the line, imaginary lines of your spinal cords. And please work on your piece of papers write down the list of the spinal bones names. Yes, CTLS, and the last one is C something. Just write it down, and we'll see you in the next slides. Continue with the details of movements and the names of the movements.